brilliant. Thank you. That's why I'm here, to be brilliant.
Me too, guys. That's why I'm here, to be brilliant. Today, we're gonna watch another section of an episode of The Pitt and see if they get it right this time. My expectations are on the floor. Thank you so much to the sponsor of today's video, ZocDoc. We'll hear more about them in a minute.
She's my boss.
Oh, what kind of work?
I'm an accountant and she's my assistant.
Oh, cool. Piper, are you okay with your boss being here while we talk?
That was my question, honestly. Like, whose boss is taking them to the ED? Not mine. I'd be like, no, thank you. I'll go alone. I like you, but we don't have that kind of relationship.
Are you sure? I'm going to be asking you some pretty personal questions.
She doesn't mind. We have no secrets.
Okay. So burning with urination, when did that start?
This resident is right to be raising an eyebrow at that. This is a red flag scenario when you have that kind of dynamic going on.
Any blood in the urine?
I don't think so. No, she would have definitely noticed that.
Okay. I'm going to get you a gown and I'll be right back. Okay?
Okay.
100% she also better be going and calling a social worker to come in or asking, for someone to help her make the other person leave so she can do a safety check.
You from Pittsburgh?
2 hours north, like Mill Village.
Okay. You have any family you want to call?
I don't have a phone.
She can use mine if she needs to.
Okay.
This is red flag for human trafficking. So a lot of times, and I have no idea what the outcome of this episode is. Karen, again, as I said, didn't give me any context. And it's not always this obvious because most people would pick up on this. But a lot of times when people are being trafficked, they come in with a female who's an older than the person who's being brought to the hospital. And it's usually somebody who is either dating or married to someone who's higher up in the organized trafficking system that the person has been a part of. And there's this kind of power play dynamic going on. And they usually won't be so obvious about like, oh, she doesn't have one, she can use mine. And the things that they're saying make it more obvious. But that's my guess as to what's going on.
Then you might need a pelvic exam.
Is that really necessary?
It could be. If there's no bladder infection, it's important to check.
Okay.
And if we do a pelvic, Laura will have you step outside for a minute.
I prefer to stay with her for support.
Piper, do you want some privacy?
No, it's cool. She can stay.
This is always a really difficult scenario when you can guess or tell that they are in a situation where they're not being allowed to answer honestly. And sometimes there's not a lot you can do about it. Because it's hard to say somebody can't stay, especially for a sensitive exam like that. Because if you're wrong about the scenario, then you may be putting someone in a position where they don't have a support person that they really wanted there. It's very difficult to navigate this situation. But I think what I would do in this scenario is instead of saying that they had to leave for the pelvic exam, I would say, like, it's our policy that we have, 5 minutes or 10 minutes or whatever to chat with somebody one-on-one as long as they're over the age of 18. So we're going to ask you to step out now so that we can ask a few questions. And that is kind of a safety mechanism that avoids putting someone in a situation where if you're wrong, getting an exam that they really wanted their support person to be there for without them, but also lets you check in and ask those safety questions. As a doctor, I want people to have easy access to compassionate, reliable healthcare, but unfortunately, our system is not really set up for that. Honestly, even I've felt overwhelmed trying to find an in-network provider with availability, and I'm in the medical field. I can't imagine how much harder that must be for someone who doesn't have the inside knowledge of how to navigate the system. That's why I am genuinely excited to be once again partnering with the sponsor of today's video, ZocDoc. ZocDoc is a free website where you can find and book appointments with high-quality in-network doctors. They have over 100,000 healthcare professionals spanning nearly every specialty, so you can easily book anything from a routine checkup to urgent care. With ZocDoc, you can browse through a list of doctors, see their real-time availability, and even read real patient patient reviews all online. So whether you need an LGBTQ friendly therapist or you're looking for a female doctor, ZocDoc makes it easy to find them, and then you just find an appointment time that works for you and book it instantly, all right there on the website. So if you've been putting off that pap smear I told you to get, or you're in need of a quick consultation for something a bit more urgent, ZocDoc lets you find a doctor fast and get the care you need when you need it. Sometimes even on the same day that you're booking the appointment. If you'd like to take control of your health and support my channel in the process, you can go to ZocDoc.com/MDJ or click on my link in the description box down below. ZocDoc is always free to use, so check them out to prioritize your health and get the quality care that you deserve. Thanks again to ZocDoc for being a wonderful sponsor. Let's get back to the video.
What do we have to do?
A CT scan of your kidneys.
How long is that going to take?
They can do it right now.
Oh, great. Let's go.
I'm sorry there's radiation. You won't be able to stay with her, but we'll be back as soon as the scan's done.
You're good with this, right?
Yeah, I'll be fine.
We'll see you in a minute.
So another element just emerged. She, the person she's with, is pregnant. So also probably a human trafficking survivor. That's often how this works. They've probably been threatened to not be alone with medical providers or anyone of any amount of power or authority who could intervene or call the police. And they're both probably terrified. But I do like the way that they handled that to get her into a safe place to ask questions. A lot of times, though, these people still won't answer questions because they are terrified for their life.
Is everything okay?
Yeah. There's no infection in your uterus or ovaries.
Okay, that's good.
But your urine test was positive for chlamydia.
Shit.
It's a sexually transmitted infection. Any idea how that happened?
Sex. Sorry, couldn't help myself. I gotta show you this. Pax, my 6-year-old, was in here yesterday and he's like, "What's this?" And he's holding a plushie. "Oh, that's HPV, bud. It's a virus." "What's this?" "Oh, that's chlamydia, bud." "What's this?" "Oh, that's trichomoniasis." And then he finally holds up a little sperm. He's like, "What's this? Where is it in my body?" I'm like, sex ed when your mom's a gynecologist. Plushie STDs and sperm that have been crocheted by my production manager. Oh, I guess I should add some helpful commentary. Did I forget my job? I forgot what I do on the internet. So chlamydia is an STD. It is transmitted by sexual contact, and it causes exactly what she's come in for. Sometimes asymptomatic, people won't even know they have it. Sometimes abnormal discharge, and sometimes burning with urination. You can test for it with a swab, like a vaginal swab, or a urine sample. And obviously I'm talking exclusively female AFAB people. And it's treatable with antibiotics. So if it moves up into the uterus and tubes, that's called PID, pelvic inflammatory disease. And multiple episodes of chlamydia, especially if they advance to PID, do correlate to an increased risk of infertility because of tubal damage. But by and large, it is a treatable STD. So get tested, get treated, no more stigmas. I mean, ideally condoms, and make your partner get tested before you have sex with them. But accidents happen, so get tested and treated.
My cheating piece of shit ex-boyfriend back home.
You need antibiotics twice a day for 10 days. That'll clear it up, and he'll need treatment too.
If I don't tell him, is there a chance his dick will fall off?
If you don't tell him, a public health nurse will. You should also test for HIV, syphilis, gonorrhea, and hepatitis.
Okay.
Any other sexual partners in the last few months?
Unfortunately, or fortunately, in this scenario for her, most of the time, men or AMAB people don't really have symptoms. And so no, his dick probably won't fall off. He'll just keep giving it to his new partners, so.
Use condoms?
Most of the time.
It's important to use them all the time.
Yeah, but if I forget, you can just give me a shot, right?
Not for some infections. This is serious.
Birth control?
Norplant. It's good for 5 years.
Norplant is an implant that goes in the arm. It's a progestin-only contraception that is easy to put in and very, very effective.
Piper, we have a question that we ask everyone. Sometimes people are pressured to have sex when they don't want to. Does that ever happen to you?
That's a great way to ask that question too. And any question that could be considered really sensitive. We ask this question to everyone. Do you feel safe in your home? Does anyone make you feel unsafe in your home? Things like that. because people feel sometimes real self-conscious and targeted, whether they're a victim or not. If you just come out and say that without prefacing it with like, I asked this to everyone, and it's probably not always completely true. We should be asking everyone, but it's part of general screening when people come through the emergency department.
If we're done here, I think I'd like to go.
Will you at least take a look at this? There's a list of resources on the back.
I don't need that.
Yeah, I know you don't have a phone, but if you could just take my number, okay?
Where's Laura?
How about taking the pen?
So this is a bit, wouldn't be the standard way that you would handle this. I wouldn't think, at least it wouldn't be my choice, because I would be worried if I'm giving people or forcing them to take things out of the hospital that have my number or my name or like resources written down, that's putting them at risk of harm.
If you ever feel unsafe or in danger, call this number. It's a national hotline. There's somebody on the other end 24/7, a trained professional who can help with anything.
I do like the idea of that pin that's open and it's on the inside.
I guess that's it then.
Well, if you change your mind, comes with a free pen.
Thank you both so much for your help.
Yeah,
Thanks.
Fuck.
that sums it up.
She'll be back.
It's how these go a lot of times. It can be really, really disheartening trying to help somebody out of situations like this, but there's no way to force people to feel safe enough to get help. And when they do, they'll open up and they'll take your resources, but you just have to keep offering until they're in a place where they think it's safe to accept that. I had a good friend in residency. Actually, she just messaged me on Instagram today and nicely said that like some of the residents were watching my videos like before they got into residency and then were like, oh my gosh, I can't believe you trained with her anyway. Hi, Katie. This was her kind of special interest area and she's very, very good at screening for human trafficking and things like that. I kind of wish I could just call her up, it's the middle of the night there, and be like, hey, can you tell my audience like better ways to do this? They did a great job. And honestly, that's probably about how I do it, but she was exceptional at doing the screening. And we had a fairly large population of trafficked people because we were right on a major highway through the middle of Texas. And it was not uncommon that we would see people who had been experiencing trafficking. I distinctly remember one that a horrific outcome. And yeah, anyway, she tried to get away without a safe place to go and ended up not living anymore. It was awful. And she had just had a baby not long before. It is a very dangerous situation for these people.
Maybe Kiara has a social services card to play. She was by Trauma 1 last I saw her.
Brilliant. Brilliant. Thank you.
That's why I'm here, to be brilliant.
Me too, guys. That's why I'm here. To be brilliant.
There are limits to what we can legally do, but I can try to talk to her.
Hi, it's Dr. McKay again. Can I come in?
Sorry. Yeah, it's a long shot anyway.
Hey, I think Piper took a pen.
Yeah.
That was actually a very, I think, well done depiction of both the patient side of being a victim of trafficking and what that looks like when they come through the hospital, and of the physician, nursing, hospital staff side of what it can feel like when you know or suspect that something like that's going on and your hands are tied and you can't help someone get to safety. It can be very frustrating, it can be very disheartening, and it can be very scary, quite frankly. Having seen what I've seen with the case I just briefly touched on, it's a nightmare. But that was a very, very good depiction. So, you know, my expectations being on the floor, they've come up quite a bit. So we've now watched 2 episodes of The Pitt. The obstetric one, no, not good. This one, I loved it. I thought that was good. So we'll watch another one at some point and decide, you know, an average, but very well done on this one.